Balza with us to chat a little bit about the science behind COVID-19. Do you just want to kind of talk about what you have been doing so far to prepare for all of this?
Sure. So I've participated with the academic cabinet in terms of making academic plans to mitigate the spread of the virus across campus. And I've also contributed to the COVID task force.
Wow.
There's been academic representation on there as well to make sure that we're, up to date in terms of the science and what we're planning. So.
Awesome. All right. So, how dangerous is COVID-19? I'm seeing like a lot of stuff on social media. It's all just kind of contradicting itself. So, from a professional's point of view.
Yeah. So I'm not surprised that you're, a little confused looking at some of the stuff out there. There's a lot of misinformation in pseudoscience and misunderstandings. And so one way to talk about how serious it is to look at the case mortality rate. And so right now in the United States, that sits at about 3%. So 3 people that have been confirmed to have COVID-19, 3% of those people end up dying from it, unfortunately. Now, that number is much higher than the actual infection mortality rate because we don't have universal testing. It's not widespread across the country. So as we do more and more tests, what we're going to see is that mortality rate drop. And we believe the infection mortality rate is something around 1% or so. And of course, that's much higher the older you are. Right? So for young people, it's very unlikely that young college-age healthy students are going to die from this disease. Nevertheless, it is very serious. The mortality rate is something like 10 times higher than that of a serious seasonal flu.
Yeah. And how is COVID-19 transmitted from one person to another?
Great question. So it's transmitted similar to that of a flu, meaning that it's transmitted by respiratory droplets. So the virus is shed from epithelial cells that line our respiratory tract into little droplets of saliva that are spread when we're talking. And that's why you don't want to sit any closer than we are now without a mask on.
Okay. And are there any lasting effects for people who recover from COVID-19?
That's also a great question. So it's a brand new virus to science.
Okay.
So with that caveat, we're learning more every day. And one of the scarier things is that on autopsy of COVID patients, we're seeing clots in blood vessels. And that's consistent with the observation that this virus, known as SARS-CoV-2, infects endothelial cells. These are cells that line your blood vessels. And so when those endothelial cells are destroyed by the virus, it can lead to clots. And the concern is that if you have clots or little microstrokes in the brain or little micro heart attacks, due to clotting in the blood vessels that feed the heart of the brain, this could have lasting effects. That's further supported, and we have more concerns because a lot of COVID patients, experiencing delirium and confusion and mental fog and things like this, and that's led to some concern there may be some lasting effects in some individuals.
And how or why is it that some people get so many symptoms and then some people are asymptomatic? How does that?
Yeah, that's a great question, and that's certainly an area of active investigation for science. What I can tell you is that there is some evidence that the smaller the dose of COVID virus that you get that makes you sick, or the inoculum, the less severe your symptoms. So we think something like on the order of 100 to 1,000 viruses it takes to make you sick. And if that number is much higher than that, your symptoms are going to be severe. If the number is less severe. Additionally, contributing to this is there is some evidence that certain aspects of your adaptive immunity can be primed to respond to COVID-19 if you've been exposed to other coronaviruses. So other coronaviruses can cause things like the common cold. And so interestingly, we think if you've had a lot of common colds lately in the past couple of years, you may be more resistant to SARS-CoV-2.
And then what's the deal with testing? I know a lot of people say it hurts. Does it hurt? What should we expect?
Good question, Hannah. So there's different types of tests. And so there's antibody tests, or what they call rapid tests that use antigens. The gold standard, the best, most sensitive form of testing that's available is a PCR-based testing method. And so if you're not sure what that means, talk to a biology major. They'll be explaining PCR to you. But basically, that's the testing method that we're going to be using on our campus.
Okay.
Now, that being said, you can get the sample in several different ways for PCR testing, right? So sometimes it's saliva-based, and sometimes it's a swab of your respiratory tract in some places. So the ones that you've probably heard horror stories about are called NP swabs, nasopharyngeal swabs.
Yep.
These are, some people call them the brain biopsy, right? My 9-year-old son just had this done. He's fine. He tested negative, but we were concerned. And it wasn't that big.
Okay.
That being said, the testing that we're going to use here on our campus is an anterior nasal swab, right? So it's basically as easy as picking your nose with a Q-tip. It's really no big deal, nothing to be worried about.
Oh, good. So then we can get tested on campus, right?
Yeah, so if a student is experiencing any symptoms whatsoever, it's very important that they contact health services. Test is provided for them.
Okay.
And again, you'll just basically, it's like sticking a Q-tip in your nose, sticking that into a test tube. It's labeled by our health services staff. It's going to be sent across the street to the Wisconsin Diagnostic Laboratories, affiliated with Freighter, and they're going to provide those testing services. The results should be back very, very quick.
Awesome.
And that's important to keep it campus.
Yeah. And then, can I get COVID by touching a doorknob, or how do I prevent that?
Yeah, so that's a good question. I mentioned earlier that the disease is transmitted by respiratory droplets.
Mm-hmm.
It's possible that a droplet could come out of someone's mouth, that was shedding the virus, land on a doorknob, a handrail, an elevator button, and then you touch that and transmit it to your own mouth by touching your face in some way, right?
Yeah.
Or your nose. There are documented cases of this happening, so it's definitely possible. And so for that reason, you want to use hand sanitizer. You'll see stations set up all over campus.
Okay.
You want to avoid touching things like elevator buttons when you don't have to.
Mm-hmm.
I open a lot of doors with my elbows these days.
Yeah.
Whatever you can to help avoid that. Now, all that being said, I don't want to make anyone paranoid. It seems like transmission by surface contact, something we call fomite transmission, is pretty rare.
Okay.
The best evidence seems to be that's something like 5 to 6% of new cases come from that sort of transfer.
Yeah.
So something like 94, 95% of cases are direct transmission of respiratory droplets.
Keep our hand sanitizer on us is what you're saying, right?
Yep, that's exactly right.
And then, is it safer to be outside than inside?
Absolutely. That's why I appreciate doing this interview outside today, not just because it's a nice day, but the best evidence we have is there's something like a 20-fold reduction in disease transmission outdoors compared to indoors. Respiratory droplets are carried away and just diluted in the atmosphere. The smaller, more enclosed, and less fresh air, ventilation that you have, right, the more rapidly this disease is transmitted. So avoid riding in confined places like elevators, right? Avoid packing a bunch of people into a dorm room and play video games. That's a really bad idea, right? Any chance you get, go outside, play cornhole instead of video games. It's going to be a lot safer outdoors.
And then, why is singing so dangerous?
Yeah, so you wouldn't think singing would be a dangerous sport these days, but actually these days singing is more dangerous than football. And the reason why is that the production of respiratory droplets correlates with amplitude and magnification of your voice, right? So the louder you're talking or singing, the more respiratory droplets you're going to produce and more aerosols you're going to produce. And so that's why it's important to avoid. Choir has been suspended for the fall semester, out of safety concerns for students.
All right. And then my last question is, why are classes being rescheduled? I know we have class on Labor Day and not really a fall break this year. And why are face-to-face classes suspended after Thanksgiving?
Yeah, so we're providing a lot of testing services and doing whatever we can to prevent the spread of the virus on our campus.
Okay.
Nevertheless, we're an open campus. Students are coming and going. Our students come from all over the country. And so the more traveling they're doing, the more they're going back to their hometowns, the more likely they are to bring that virus back to our campus. Okay. And so by suspending face-to-face classes after Thanksgiving, we're going to reduce the amount of potential that the virus is brought back on campus.
People going home and bringing it back here.
Yep, and that's why, for example, the day we would typically have Labor Day break is going to be a day of instruction here on this campus.
Okay. Awesome. Well, thank you so much.
My pleasure. It's been great talking to you, Hannah.